How much do you have to work with people's, or how much are you able to influence people's spirit? I mean, when they come in here, I can only imagine what it's like to have cancer. And I can only imagine that so many people just want to give up.
Right, that's true. That is one of the hidden beauties of acupuncture, actually, is that we do a lot of psychological assessment, a lot of psychological work for the pain patients and the cancer patients. Many of the pain patients they're irritable and grumpy, they're in a lot of pain, they've been to a lot of doctors, they haven't had relief, and as the acupuncture starts to work, we can sort of see their true personality begin to emerge. Usually by the third or fourth visit, they can laugh and joke with us. You know, they can say, oh, you know, I heard this funny story, something like that. You can really see a difference. And also, I think people will frequently tell someone who's doing acupuncture things that they may not have shared with another practitioner, simply because we are doing points that help bring some of those issues up to the forefront.
So do you actually deliver the needles?
Yes, I actually put the needles in, right.
Yeah.
Mm-hmm.
So you first started out getting acupuncture and you realized how much it helped.
Right.
That's what prompted you to
Yes,
get a study.
Exactly. And if you had told me, 15 years ago, well, you're going to be doing acupuncture, I would have looked at you like, what are you talking about? Not that I was against it, it wasn't part of anything that I had really thought of or planned. But that's the interesting thing about life, isn't it? You start out in one spot and then you end up somewhere else and loving it, you know.
Is acupuncture more popular in California than, say, the East Coast?
I think it's very popular on the East Coast and definitely in California. And I think there are many places in the Midwest where it is becoming more popular because you have more people doing it, both physicians and non-physicians, and it's more in the literature. There was a huge study that was done that they talked about at the recent ASCO meeting, which is the American Society of Clinical Oncology, that talked about the use for acupuncture in cancer patients. So it's really getting more mainstream, which is exciting.
And how do your other physician peers relate to acupuncture? I'm sure that many of them just dismiss it as nonsense.
Some do dismiss it, yes. But over the years, I have seen more people give it credence and more people willing to refer their patients to me to try those techniques. I have some physician colleagues, particularly at USC, who have been backers of me from the start, and it's been wonderful, and I've treated their patients. They're rheumatologists, and they've sent me patients over the years. There are some surgeons, particularly orthopedic surgeons, who have found it to be particularly useful for their patients post-operatively. That means after, let's say you were injured at work to your hand, you've had your surgery, you've done physical therapy, you still don't have full function or you still have a lot of pain, then we take that patient and work with them.